Male was admitted with poorly controlled type 1 diabetes mellitus. He's had multiple hospitalizations for DKA. He hasn't regularly been taking his insulin or checking his blood sugars. I am very concerned about this patient's health and well-being.
Many of the things that were causing the readmission rate were things out of our control. Who could go into the home, check on the patient, begin to assess that component? And we also recognized that some of our partners were better at it than we were, that we could use existing programs that people didn't really realize were available or didn't have access to.
A lot of our patients at the hospital here are elderly individuals, and so I actually went out to Connections, our area of aging, to talk to them about their services and to see if they wanted to partner with us to maybe look at when an individual leaves the hospital, following them when they go home, to help look at how do we keep them in their home instead of having them come back to the hospital.
He said, you have a high tolerance to that pain. He said, you took it good. Well, like in my case, I was the one doing the driving and everything. So, and I couldn't do that. So they helped out on figuring out my transportation to and from the doctor's appointments and all the stuff I had to do on that part of it.
In our first year, we were able to decrease our readmissions by about 19%. Once we started recognizing what some of those issues were, then the program continued to build.
Okay. Are you guys doing okay?
We do have some patients on the floor that will come, as a direct admit, but most of them, I would say, probably come through the emergency room that have more of those needs. And today's one of those days.
We've had people come into the emergency room, and these are going to be your individuals that probably have some mental illness and substance abuse, and really probably have not really felt like they've been loved much.
So if I have a patient that I know is following with like Heartland Family Service, I will send them through TAV a notice that that patient is here, so that they can, sometimes they will come up and see them. Let me go tell this family that we've got a ride for them.
What I hear from my community partners all the time is that we are further ahead than most areas. And this isn't something that just Jenny Edmondson's working on. It is something that's being done across the entire United States, is working on care coordination. Several individuals, obviously, who have gone through the program, whose lives are much better just because we've touched them and been in the program and helped them. So.
We all have a piece, and we all need to be able to work together and connect, and I think ultimately it changes people's lives.